Do. Oh my God, Matthew Holt. Breaking news. We're coming in hot with a special report. The all Livongo and Teladoc merger episode of Health in 2.00, August 5th, 2020. We have our swag on, our Livongo Silent Snorzy Healthcare t-shirts from 2018, our coats from 2018. You gotta wear it while you can.
I lost my coat. It's in Heathrow Airport where I left it. It's like it bundles up in a nice little package.
That's like a collector's item now. What have you done?
Somebody wanting around Heathrow Airport, a baggage handler has now got that. It's going to make a fortune off this collector's item. All right.
Speaking of making a fortune, for those who don't know, we might be responsible, Matthew, for this merger because Livongo and Teladoc are both sponsors.
We should take credit completely. It was all our fault.
We're totally going to take credit. We need a percentage.
So I think they use Morgan Stanley, and they use Morgan Stanley, and they use Goldman Sachs, and we should get the same check that they do.
Okay, I'm in for that.
We're in for that.
I think we planted the seed for this idea. I think we've said so many times, and their branding has appeared together for so long with us.
Exactly.
It just suddenly became a reality. Are you going to break down the deal for us or what? Yeah, let's do it.
In
2 minutes.
What it means for the future of our...
Yeah.
yeah, maybe.
Well, like I said, I mean, everybody's talking about the genie out of the bottle for Teladoc. Well, who knew the genie was not only out of the bottle, but also granting wishes? Hey.
All right.
You ready?
I'm ready.
All right, let's do it.
Hang on.
Oh my God, the suspense is killing me. All right, break down the terms of this deal. Livongo and Teladoc merge.
So it's a merger, but it's a merger with Teladoc. Clearly, the Teladoc crew is gonna run it afterwards. Jason Gorovich stays the CEO. It looks to me like the entire Livongo team is going to sail off into the sunset and be very happy sunset. We'll have to find out obviously more details about that. We don't know, but basically it was that they got. Yesterday's close, which is not the same as we're trading today, Teladoc was worth 20 billion, Livongo was worth about 14 billion, and the offer at that stage was for about 18 billion, so a little bit less than half the company, was going to be from Teladoc to Livongo. Was really the valuation. It was pretty much a straight merger. There's a little bit of cash, but not that much involved. About $11 a share for Livongo. So it's kind of a takeover, but it's definitely a merger of equals because one of them is the leader in sort of chronic care management and effectively remote care monitoring, and the other one is obviously the leader in telehealth.
All right, so what do you think this means? We heard Jason Gorovich and Glenn Tolman both on Kramer earlier today talking about this deal. So strategically, tell me what this means in the short term and in the long term.
Well, certainly in the short term, they will look at each other going, God, if we're, where are we going to go? Teladoc's going to have to do remote monitoring. Teladoc's got to remember that it owns a bit of Vida, which is an interesting part. So they're going to have to do remote monitoring, coaching, all the Livongo stuff. Livongo was thinking we've got connections to telehealth. We've already able to do more in that world, and they looked at each other and went, we're better off if we are the guys sitting on the high stock price. If we put ours together, we'll see how it goes. The market, by the way, hates it because it's now back down to where it was like 3 days ago.
Yeah, I know, it's crazy.
How they priced this deal, how they would price this deal with the stock, each of their stocks going up and down like a yo-yo at 20% of there. I don't know.
All right, why do you think the market hates this so much?
Because they think the Robinhood traders can't get into it anymore.
All right, and what do you think is going to happen next then? So, what's the big takeaway here? Because so in the shorter long term, it makes a lot of sense, but in the longer long term, what do you think is going to happen? I keep saying this monster now is going to get bought by Amazon, or Walmart.
So hold on, but think about what they're really doing first, right? So the first thing that's happening is with COVID and the rush towards more telehealth, the deal we saw just a couple of days, not the deal, but the licensing, the renewal of the emergency period. So basically permanent payment for telehealth we saw a couple of days ago. The remote patient monitoring that Livongo is going to get into, those codes, but also both of them got this huge employer client base. What they're building, and both more so Livongo than Teladoc, have got into started to move into the health plan space with Medicare Advantage. You're starting to figure out all the stuff that, funny enough, you and I have been talking about, this continuous clinic idea, right? Which is we've got services for people who are, having an acute episode but are basically healthy, which is Teladoc's main market. We're going to have behavioral health, which both of them have got, by the way. Teladoc's got a better help and Livongo's got high strength. Then you've got to think about, right, well, that's the stuff for people who are basically okay but need something acute, remote. Then you've got all the chronic care stuff, which is where the real money is. Diabetes, and then the stuff they haven't really in mental health is in that as well. The stuff they haven't really got. I mean, Livongo's got something in high blood pressure, hasn't really done much in musculoskeletal, hasn't really done much in respiratory. Those gaps are going to be plugged in. And you're building something which can be a continuous clinic, which could basically be the front door and the engine room for almost all care. So then you think out what else have they not got? Well, they don't have physical primary care. I can't imagine they're not thinking about that for an alliance or another purchase.
This is where Amazon makes sense to me.
Well, here's the issue. Right? But now they're that. What everyone else can say, this is really moving fast. They're going to be able to take this to every employer in the country very quickly. They've got all the employers in the country between them. They've also got hooks into lots of health plans and some systems between them. So then you're going to think, well, who's their competitor? Their competitors now aren't really American Well and Armada. Their competitors now are Optum and maybe Anthem. Are they a customer? Some of the bigger systems. Are their competitor Kaiser? So you go down the path of saying, are they really setting themselves up to become a new type of delivery system, which fits very well into the little thing we've been talking about, right? The continuous clinic. So then the enterprise is who else wants to do that? Well, Amazon's clearly been moving there with crossover and its other deals and PillPack and whatever. There are pieces they've got. Potentially Google or Apple could move that way. Your friends at Walmart, you're always talking about.
Brilliant.
But to buy now, whatever it is, a $35 billion company to get into that is really a big nut to crack at this level of the stock price. Whereas most of those guys could build it themselves. So I think that's kind of where...
Yeah, but why build it yourself? Because they've tried that. I mean, look at Amazon trying to build up and look at Haven. Okay,
well, Haven was a separate story.
I understand that, but it's like I think that proved the case that it's a lot harder to build this stuff yourself. Why not just spend a little bit more money and just buy the box off the shelf, unwrap that, and just plug it in?
Well, maybe.
I don't know.
It's all.
Believe it or not, I actually called this in a really messed up way. I saw this coming. I told John Halleck at Livongo. I'm telling you.
All right, what is it?
It was the next logical step. Everybody's like, what's Livongo going to acquire? And I'm like, I think Livongo may be acquired.
Well, I must say, I thought they would be acquired earlier in the cycle at a cheaper price and not by another company. That's the other joke, right? We have two companies who have massive stock market valuations run up over the last 3 months, have never made a profit between them. And now, you have this financial engineering. But if you look at what the component parts are, it's probably most of what you need to do care in the new way in the next decade. And I think and there's some really smart distribution on the Teladoc side. There's some really good distribution on the Livongo side. There's some really smart AI under the hood on Livongo. There's a lot more to be added, but it's a very interesting deal. And it's really sort of throwing the cat. I would say it's throwing the cat amongst the pigeons. It's like the cat amongst the vultures, because the people that have to think about this are the really big players in healthcare. It is CVS Aetna. It is Cigna Express Scripts. It is Anthem. It is Optum. They're going to go, Kaiser, what kind of services are we going to start delivering that we don't have already? And do we work with these guys, or are they the new competition? I think it's an interesting, it's definitely an interesting world. It's a big day. And as I said, our T-shirts are going to be collector's items.
Thank God, I held onto my jacket.
We got something out of them. We got a T-shirt out of them when they sponsored the show.
Oh my God, we were silencing noisy healthcare, and now look at us cheering on.
A lot of noise going on.
Cheering on virtual care. You can tell, Teladoc never had a party that they invited us to. Otherwise, we'd be wearing their swag.
Like a virtual conference the other day. Yeah. Well, worth mentioning at the end of this that we announced that we're having our new book club, which is going to have.
Which just got a whole lot more exciting.
General Catalyst, who must be licking his chops. I don't know how much of that he's sold recently, but he's already been reinvesting that money in Roe and a bunch of others, right? And then you've got Steve Klasko, who's the CEO of Jefferson, who uses, by the way, both Teladoc and Livongo as part of their provider service offering, and are very interesting. They may be So they may be an interesting test case. And then
And
Glenn invited himself. Glenn Tillman invited himself on the show, even though he hasn't written the book. He wrote another
He's
book.
like a fan. And he was going to wrap it all together and tell us about consumer-directed virtual care. And now we actually really have lots of questions about consumer-directed virtual care.
We'll have to try and focus on the book a little bit.
How lucky are we that we had that scheduled? Let's hope that sticks on the calendar. So that's coming up when, Matthew? That's coming up, I think,
coming up. We're going to publish it, I think, on August the 16th when we do the interview, the 15th, 14th, or 15th. So
that's right. So you guys check out our book club on the healthcare blog, because who knew that was going to be a success?
We'll see.
We'll see.
All right, Jessica. Well, it's an exciting, interesting day in digital health. I remember, 2 years ago, maybe it was 18 months now, 2.5 years ago at the Health Window Winter Tech Conference, JP Morgan Week, and everyone started and said, where are the healthcare IPOs? Where's the big exits? Well, this is the logical conclusion of it, right?
Exciting stuff. If you guys want to follow along with us as we make more sense of all of the ever-changing landscape here in digital health and in telehealth and virtual care, consumer-directed or not, please follow along with us on Twitter. You can follow him at BoltyBoy. I'm at DaMassa, and sign up to receive our newsletter from the healthcare blog. And hey, participate in our book club. We'll find out what Glenn has to say about this, as well as Hemant and Steve, and see what they think about what's next. So I'm really excited for that. Matthew, thank you for the special report here.
It was fun. Yesterday we got our editorial people up late across the other side of the world. We're going to fix this for us and get us out. So thanks to them, and we'll see you all soon.
All right. Thanks, guys.